Our next Martha must-have is a must-have for your health. My own dentist, Dr. Marc Lowenberg, is here to show you why. Next on Martha. So I thought it would be really valuable to invite my dentist, who I've been emailing about a problem I've been having with TMJ for the last couple weeks. I decided I would ask Dr. Marc Lowenberg to come here to the studio and talk about 3 important oral health issues that many people face but don't usually talk about. And I don't know why. I talk about my sore jaw all the time. Please welcome Dr. Marc Lowenberg. Hi. I am very glad you could come.
How are you?
How are you?
Good.
Dr. Lowen, how long have I been coming to you, Dr. Lowenberg?
Too many years to count.
Yeah, too many, but such good years.
But you still look magnificent after all these years.
Thank you. And he takes such good care of my teeth. And he's one of these dentists that's like painless. I don't think I've ever really been hurt by you.
Well, that's because I'm afraid to hurt you.
Yeah. Well, let's start with the TMJ, because see, you can actually see it on my face. See this little bump here? It's like that muscle right here.
It's that muscle.
Yeah, and I don't know what happened. It's either the stock market or the financial economic situation in America.
No, it's all of those things.
Oh, it's everything. I mean, I just got 2 new cats. We're going to talk about that some other time, but they kept me up all night and my jaw started to hurt.
Well, you'll be happy to hear that ever since you called me with your problem, I developed it myself.
Oh, you did?
Yes.
Oh, excellent.
I can't even open my mouth anymore.
Sympathy, that's what it is.
It's sympathy pain. But you know, TMJ is something that occurs to a large part of our population, and it really is caused by stress. And what happens when you're under stress, and it could be the economic times we're living through, is what happens is you clench or grind your teeth.
At night.
And when you do that,
well,
sometimes people do it during the day. Absolutely. And when you do that, what happens is the muscles that open and close the joint go into spasm. Now, I brought my old friend Barney with me.
Hi, Barney.
This is my skull from dental school.
Isn't that very good teeth?
And by the way, I was going to say, I did not do his dental work.
Oh, my gosh.
But I brought this along to explain how this works, and it's really very interesting. Only the lower jaw moves. The rest of the skull is stationary, and the lower jaw moves in a ball and joint socket
right
like
here?
this. Yes. So what happens is, I'm going to pull this out just so you can see.
Yeah.
This is called the condyle, and it goes into the fossa like this. And the jaw normally opens and closes in an even motion.
Right.
But when you're stressed and you grind your teeth or clench your teeth, it starts irritating the muscles, and it causes them to go into...
Muscles or the actual bone?
Well, it's the muscles.
Okay.
And then the muscles pull your mouth open in a different direction. So it's very similar to a shade on a window where you pull up a shade and half the shade goes up cockeyed.
A little crooked.
That's what happens in your jaw. So it usually favors one side.
So does your bite kind of go off a little bit?
Your bite goes off.
My bite's off a little bit.
Your bite goes off. You can't open your mouth.
What are you going to do?
And the way that you treat this, first of all, the best thing to do is to come into your dentist, which I've been begging you to do.
Yes.
So, and the dentist usually can make night guards. There are all different kinds of night guards. You can make a night guard that you clip over your teeth so that when you're sleeping, you grind on this plastic instead of grinding against tooth against tooth.
Right.
And that helps break the spasm in your jaw.
Oh, that's a good
If
idea.
you can't get to your dentist, there are definitely tricks that you should do.
Well, I've actually been using the little trays that for brightening your teeth.
Right.
I've been putting the lower tray in. Is that
Does that
good
help?
enough? Yeah.
Well, if it works, it's great. But if you can't get to a dentist to make a night guard, then the best way of dealing with
this has little gold chain in it and stuff. I like that.
This is the Rolls Royce of night guards.
This looks like Gucci or something.
But if you can't get to your dentist, then what you have to do is you have to concentrate on keeping your teeth apart during the day, because a lot of people clench during the day. And when you go to sleep at night, if you could take something like Tylenol PM that will calm you down so you won't clench in the sleep, that will help.
That's good.
So that's the TMJ problems.
Oh, I did one thing, and I know that Triumph will love this. I used this toothbrush on that spot back there just to massage it, and it really helped.
Really?
Yeah.
Well, that's great. So
it was great.
Whatever works is great to do.
But I thought
speaking of the toothbrush, the next biggest problem that we have in America is gum disease. Right. Over 50% of the population has gum disease and don't even realize it. One of the major signs of gum disease is that your gums start bleeding when you brush or floss your teeth, and it's incredible how many people ignore that.
So I want to see some
you know, in healthy gums. In healthy gums, the gum tissue is pink and flat, and it sits directly over the bone. But once you get inflammation of the gum tissue, you start developing something called periodontal disease, which is an inflammation of the gums. So in mild periodontitis, periodontitis, you only have an inflammation located on the gums itself. So you start seeing a swelling in the gum tissue or a redness.
And that's why after you do the exam, when you get your teeth cleaned, I hope your dentist pokes you with a little tiny poker all around.
It's not a poker, it's a probe.
A probe.
It
but,
measures,
but he does that very carefully around, and you always tell me I have very healthy gums.
You do, you have great gums. I've always said that about you. But what happens is, if you don't take care of it, if you don't floss and brush your teeth properly, it advances to moderate gum disease, where you start getting recession of the gums get more swollen, more red, they bleed more readily. You know, it's interesting, if any other part of your body started to bleed, you'd run to the doctor. But when your gums bleed, people just ignore it.
Right.
So what happens is, if it's not treated, it goes on to severe gum disease, where you get massive amounts of recession, a lot of bone loss around the teeth. The teeth you start noticing there are spaces between your teeth.
They get loose?
Because the bone is deteriorating and your teeth are moving. Now,
that looks long in the tooth. Is that where the expression comes
yes,
from?
because as you get older, you have more gum recession, more tooth shows, and that's where the expression long in the tooth comes from. We, by the way, have very short teeth.
That's right.
We're not long in the
keeping
tooth.
our short teeth.
So gum disease is something that's prevalent throughout our entire society, but you could definitely control it by flossing and brushing properly. You have to at least brush and floss every 24 hours, because it takes 24 hours for the bacteria to do any damage.
And Julia Roberts really made flossing very proper and okay. You know, remember in the movie Pretty Woman, where he wants to see what she has in her hand, he thinks she's stealing, and she opens up and it's dental floss.
Right.
Yeah, she made it okay.
She totally built my practice.
Now, the last thing is oral cancer.
Oral cancer. Oral cancer is something that I think most people don't even pay attention to. You know, it's very interesting, because there are so many other cancers that we focus on. Breast cancer, we teach women how to do self-examinations, but people never teach their patients how to do self-examinations for oral cancer. Oral cancer shows up on the side borders of the tongue, under the tongue, or on the lips. It could either be a white lesion or a red lesion. There's no definitive lesion, but
that's cancer on the tongue there?
This is an example of it. But that doesn't mean if you have one of these sores, you have cancer. But you have to look at your tongue. You know, when you brush your teeth, you have to stick your tongue out and look to see if there are any sores there, because if there are, and they last for more than 2 weeks, then you have to go to your dentist and have him take a look at it.
Well, when we come back, Dr. Lowenberg's going to take questions from our studio audience. Think up something to ask. It's good advice. Don't go away. I always love taking questions from our studio audience, but I especially love when they have a chance to ask our guests questions, particularly the medical experts we have on the show. And Dr. Lowenberg has graciously agreed to answer questions.
Absolutely.
Please raise your hand if you have one. Right there.
Hi, I'm Amy from Omaha, Nebraska, and I was wondering, why do we get morning breath?
That's a great question.
Morning what?
Breath.
Oh, morning breath.
Yeah, morning breath. What I want to know is, how come on TV and in the movies nobody wakes up with morning breath? that's what I can't figure out.
Yeah, they always can kiss each other.
Yeah, exactly. That doesn't happen in real life. But the answer for that is, because one of the things that happens to combat bad breath is your salivary flow. During the day, your saliva is flowing. You're talking, you're eating, you're chewing gum. All that stuff stimulates salivary flow. When you're asleep, your mouth is usually closed, the saliva is not flowing, and it is not washing away any of the bacteria that's just sitting there. So the best way of combating it is to brush and floss your teeth before you go to sleep, but also to rinse with a antiseptic mouthwash, so you kill whatever bacteria is there before you go to sleep. Or you could just sleep for 1 hour, and then you won't wake up with morning breath.
So morning breath, you don't say bad breath. You say morning breath.
I call it anything you want.
Okay. Hi.
Hi, I'm Nicole from Florida, and I've tried the dentist systems, bleaching systems, as well as the over-the-counter systems. And I'm just wondering what the long-term side effects might be.
Well, I think the answer to that question would apply to anything. Moderation. If you overdo anything, it's not going to be good for you. The long-term effects of bleaching are very minimal, providing that you do it according to the directions. If you buy over-the-counter products, you have to adhere to their directions. If you're not going to adhere to the directions and you're going to use anything every single day, as some people do, you're going to create great sensitivity in your teeth, because the bleaching systems are not meant to be done every day. And if you're using a dentist-delivered product, that's even stronger than the over-the-counter product. So you certainly cannot do that every day.
You don't know that I took pictures of myself with the bleaching trays in my mouth at your office with my phone. So they're on my, I wish I had them. But that was a very effective bleaching system.
Right.
What was that, laser? With your mouth is all open?
It's called power bleaching.
Okay.
It's not a laser, it's a white light.
Oh, okay.
But that's something that's only performed in the dental
Yeah.
office.
Yeah, I don't
Right.
want one of those at home.
And you can't overdo that
frightening looking.
because the dentist is regulating it. So moderation is the key.
Thank you.
Hi, Martha. I'm Ashley Hatcher from right here in New York. My question for you, doctor, is how do you feel about veneers?
Veneers.
Well, I'm a little prejudiced. I'm a cosmetic dentist, so I love veneers. I've veneered my kids' teeth, my wife's teeth. As long as veneers are done well, they're a great way of changing the look of your smile. They could change the color and the shape of your teeth. They could give you that Hollywood smile, but unfortunately, they are very expensive to do.
And do they last?
They last for about 20 years.
Oh, they do?
Yeah.
Yeah.
Actually, I have veneers on my teeth. How do you like them?
Yeah, you look good.
Thank you.
Yeah. I do not have veneers.
No, she's a natural beauty. I needed help.
Thank you.
Another question?
Hi, my name is Lauren Lustig and I'm from Manhattan. My question is, can flossing extend your lifespan?
Okay. Well,
Lifespan.
There was recently a survey done of doctors and dentists, physicians and dentists, and 90% of them feel that there is a definite link between inflammation of your gum tissue and inflammation in other parts of your body, particularly your heart. So the theory is that if you floss and brush your teeth properly and remove all of that plaque that sits on your teeth, it is going to be better for your lifespan. However, this has not scientifically been proven yet. But since we know that that's a theory, it would behoove everybody to really floss their teeth and brush them properly now.
Thank you.
Well, thank you for your wonderful questions, and thank you for your wonderful answers.
you.
There's so much to learn about oral health, really.
Absolutely.
And it's really amazing. And we'll have Dr. Lowenberg on
And
again.
by the way, I see you have these apples
Yes.
here. An apple a day. This will help keep your teeth clean and healthy.
Excellent. We'll be right back with Chef Bill Tavey. Stay tuned.